Dr. Shuyan Shao was on a University of Chicago medicine lecture and research tour in his hometown of Wuhan in mid-January, right when the coronavirus outbreak was ramping up. As with all of his U of C trips there, social distancing could be measured in inches. But then came the crisis, and Dr. Shao, a pathologist more used to a lab than a bedside, began tending to patients in need. For them and him, it would be a life-changing and life-saving month of January.
Professionally, we all have made a commitment that you're committed to do some job and you should do it. I think that's the most important reason.
Last month, we told you what Shao did in China. Now he's back on the job in Chicago, but fighting the same virus as 7,300 miles away, a virus that needed no visa to travel the world.
No one knows exactly how many people or what proportion of people are infected in each population, because all the figures just depend on your test sensitivities and how many people you test.
Even though Wuhan is 5 times larger than Chicago, its residents live in much denser conditions and have a much stricter lockdown in place. COVID death rates for the two cities are not as far apart as you might expect. Chicago's COVID death rate is approaching Wuhan's, even though a milder shelter in place here started 2 months after Wuhan's. Yesterday, the last 12 coronavirus patients were released from a Wuhan hospital, a sharp turning point for the city where it all started. Shao tonight says Illinois' crisis might even have been worse had it not been for early intervention by state and local governments. Has anything changed since we last spoke in terms of the anatomy of the germ that you found?
So there are some mutations that have been reported in literature from different labs. However, there's no dramatic changes in terms of the genome sequence, but there's no major mutation that will cause the change in virulence or transmissibilities.
And that's a good thing.
That's a good thing.
Do you believe that there is going to be a fall or winter return of this that could be worse than what we've seen?
So the safe thing to say is that this epidemic will come back at some point, but whether that is going to be more severe than it is now, I can only guess based on the fact that if we are having, as some people have suggested, that maybe like 30% of people have had asymptomatic infection, then at least we had some level of herd immunity.
Until the fall or winter wave, Dr. Shao says he is practicing telemedicine and telepathology, working research projects, writing papers, and trying to stay optimistic.
I don't think that we have total control of the situation. No one is in control, but we just have to do our best and hope that it will not happen to you. But when it happens to you, you hope that you only get the asymptomatic infection.
Despite being at the epicenter of the pandemic when it began, Shao says he's managed to avoid getting sick by practicing what he preaches, getting enough sleep, nutrition, and exercise, and, says the doctor, keeping social distance.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.